Oh, who's talking, please?
Is it Mr. Jonathan O'Brien?
Yes, it is.
Dr. Desmond from GP from St. Luke's.
Right, hello.
Hi, how are you, sir?
How can I help you?
Hi, so it's a follow-up call. I think you had a consultation with one of my colleagues earlier this afternoon.
Okay.
Yeah, so I'm just calling to have a chat about your request.
Okay.
Yeah. So she was having a discussion with you about diazepam. And from what I can read here, she was having a chat about some other options as well. Are you with me?
My silence, I am listening to you.
Okay. So that's why I wanted to have a chat with you. So how can I help?
I'm sorry. Did you speak to your colleague or did you not speak with your colleague?
I did speak to my colleague.
Right, so why are you asking me how you can help me when you just told me that you were speaking to your colleague?
Yes, because as I said, I'm calling because you wanted diazepam, which she discussed a few other options with you.
I told her that I would like diazepam. I explained why. So are you going to prescribe me some diazepam?
Well, that's why I need to speak to you about it first.
I had a 45-minute conversation with your colleague, and now you wish to go over it again with me for some unknown reason. Did your colleague not brief you in what was said?
I've mentioned to you earlier on that I've spoken to your colleague. Obviously, I'm
not my colleague. Not my colleague. You didn't speak to my colleague. You spoke to your colleague.
Yes, I've spoken to my colleague.
So did she brief you, sir?
Okay. You've had a 45 minutes consultation. She's not going to tell me everything you said in 45 minutes, is it?
Excuse me. Why do you believe I made a phone call to the doctors?
Okay. I'm here to help you, okay?
Excuse me, sir.
All right.
Why do you believe I made a phone call to the doctors?
From my understanding, you requested diazepam.
Thank you.
You haven't had diazepam for more than a year.
I understand this because I only take diazepam, doctor, if and when I need it. Now, I don't see the point in going over the same thing again with you. I am interested in the other options. However, the reason I called was to ask for a week's supply of diazepam. That is the first thing I asked. When you answer that, I'm very happy to move on to the next thing.
Okay. So you want a week of diazepam. So I'm asking you, well, why do you need a diazepam? Or what do you use the diazepam?
I have already covered this with your colleague. Please let me know what she wrote in my notes. Let me know you have them in front of you because you are simply wasting my time. You want me to explain again to you after you just confirmed that you spoke to your colleague as to why I need diazepam. Would you care to look at my records and to look at what the lady wrote down from our conversation, please, doctor?
Okay, I don't think that helps me. I'm a clinician, and I need to get information from you to be able to help you, sir.
So why don't you look at my notes as to what was said with your colleague less than 3 hours ago?
Okay. So
that's
you're
a good start.
Okay. You're not willing to discuss your issue with me? Is that what you're saying?
Oh, I'm not letting you off that easy, brother. I discussed my issue with a certified doctor. Why are you asking me to discuss it again?
So that I can know how best to help you, sir.
But you already confirmed that you spoke to your colleague. What did your colleague tell you, please, doctor?
Well, that's...
Now he's cut himself off from me.
You said you had a 45 minutes consultation. I'm not going to go...
No, it was more like 20 minutes.
Okay.
So you know that I've asked for diazepam. Are you going to give it to me or are you not going to give it to me?
You said,
This man's moronic. What do you need to know again?
If you engage with me and we had okay. I'm willing to help you. That's why I call back, sir.
Well, please prescribe me with a week's worth of diazepam,
engage with me.
and then put me into the PAL. Are you listening to me or just talking over me? Thank you. So please, doctor, prescribe me with a week's...
I haven't said a word. I'm listening. Did I say a word?
You're talking now. May I speak? I'll accept that as a yes.
No, when you asked me if I was talking over you, I wasn't saying anything.
Now we're having a conversation about you talking over me. Would you just be quiet, please? Thank you. So, yes, I asked for a week's supply of diazepam, doctor, which I would probably use over the course of a year, because as I confirmed with your colleague, who clearly wasn't listening, I only take it when I need it. I have tried with letters from your surgery to get into PALS, to get into the West Northamptonshire mental health team, but on 3 occasions they rejected me. So, yes, I am very happy to look at alternative therapies, cognitive and everything else, but in the meantime, I have asked you to supply me, please, with a week's worth of diazepam, which, as you know, will take me about 18 months to get through. So you know that I'm not eating these things like sweets. You know that I'm only taking them if and when I need them. Thank you.
So, if you get a week's supply of diazepam, how often are you using it then?
Are you understanding what I am saying here?
Well, when do you normally use it? I understood you. When do you tend to use it? You said...
Where do I intend to use it, brother? Doctor, where do I intend... Where do I
normally use it?
Are you asking me where I normally use it?
When? I didn't say where.
Right, for the 4th time.
When?
Yeah, because you told me you were listening. Clearly you're not. You're trying to trick me. I told you that a week's supply of diazepam could take me anything up to a year to use. Yet again, I will tell you again in clear English, because I only use it when I need it.
Okay. So my question was that you said you use it when you need it, okay? I understand that. I don't doubt that, all right? So the question I asked you is that, so when do you use it? When you say when you need it, when do you normally need it?
Why are you asking me this question? I have already answered this question with your colleague. Why are you asking me this question again? Did your colleague make notes, or are you simply trying to catch me out and not supply me with diazepam? What are you up to? Your colleague told me, doctor, that she made notes. I suggest you read them. Please read the notes of our conversation, sir.
I'm not here to catch you, and that's not my intention, okay?
Oh, you're just divert. Will you read the notes, or will you not read the notes?
Yes.
Now, I'm asking you, can you read the screen in front of you?
Okay? Being difficult, I asked a simple question.
Yes, and that simple question was asked to me 3 hours ago by another doctor.
I'm not here to catch you in any way as well. As I said, I'm willing to have a dialogue with you and help you out. But
well, when are you going to start helping me out rather than trying to catch me out? You're asking someone with mental health problems.
I'll send that.
Sorry, sir?
I'll prescribe your diazepam for you for a week. I'll prescribe it for you. I'll send it to Touchwood for you. I'm not here to catch you in any way.
Fine, we've covered that. So, well, thank you for that. That's the first part. I am getting it right. Thank you very much. I'd like to ask you, how many tablets does that include, please, doctor?
I've sent you 7 tablets. I'll send that to the pharmacy for you.
Okay, and you expect that to last me another 18 months, do you? But okay, that's fine. Thank you very much. When will that be with the pharmacy? Tomorrow or today?
I'll send it to the pharmacy now. If they are still open, it's probably too late now. You can pick it up.
No problem, doctor. So the second thing that you said to me, which I found very interesting, what further help can you give me, please, other than the 7 days worth of 7 tablets, which I guess I should be grateful for. But
my colleague offered to refer you to mental health team.
Yes, please do it then. And do it for the second time, third time, and they will, for the third time, they will not listen to anything you write to them, and they will simply reject me because I've been there twice already after you wrote letters to them in the first place. So basically, you're very ineffectual. You don't get anything done. So you write to them again, sir, which I'll be very grateful for. And in a month's time, I can have this very same conversation with you again when they don't accept me. Okay? So you do the paperwork. You tick the boxes.
I don't get the point. I mean, you said I'm very what? Did you say I'm ineffective? Is that what you said?
Oh, absolutely. Because when you write to PALs in Northampton, they will ignore you. So it will be very ineffective. Your good doctor before, sir, has already written and they ignored that. So you simply want to do exactly the same thing again in order to tick the box and to say that you have helped me. So yes, I am very grateful because pressure, not Jonathan, thank you.
Listen.
Do not blackmail me, doctor.
Okay.
I would like to be referred. Do not call me Jonathan. I would like to be referred. Okay. I am just pointing out to you, sir, that they will ignore you, and in a month's time, I will be having this very same conversation with you again.
Okay, sorry, you didn't conclude. Sorry, you said you don't want to be referred to as Jonathan. How do you want to be referred to, sir? Hello?
Don't play silly games, okay? You can refer to me as John. Thank you very much.
No. Okay, so you prefer to be called John. Thanks. I'm sorry if I call you Jonathan.
Oh, just, yeah, whatever.
So that's why I was calling you by what I have here. But please, obviously, if you said you've been referred before and you've not been seen, I'm not going to. If you don't want me to, I don't have to refer you. Okay?
Excuse me, doctor.
It takes time to be referred.
What part of me saying to you? What part of me saying to you, I would like to be referred, makes your ears hear that I didn't say that. I want to be referred. Would you like me to say it 10 more times just so you understand? Okay. I did not suggest or say that I didn't want to be referred.
You just told me I'm being ineffective.
You don't even understand what I am saying. For the third time, I'll explain it to you. Would you like to wind your silly neck in? For the third time, I will explain it to you. Are you ready? Right, your doctors have written a letter to mental... Are you that weak? Are you a weak man? You're a weak man. Are you not courageous? You're a weak man.
You can call me whatever you wish.
Yes, you're weak. You're not listening to what I'm saying. I would like to be... Will you stop talking and start listening, you silly man? I would like to be referred, please, doctor. And as I said, but you didn't understand, your office is... the PALS team, it's very ineffectual because the PALS team simply look as if they ignore you. So therefore, your office is ineffectual because you are meeting some bigotry, you are meeting some racism, you are meeting something at the other end that simply doesn't listen to what you're saying.
I spoke to you respectfully, sir, John. I spoke to you respectfully. I never at any point insulted you in any way.
Oh, have I insulted you then? I've insulted you. I'm calling you names. I called you doctor and sir.
Yeah.
Are you feeling okay yourself?
You didn't call me silly man.
Are you listening to me, brother?
You told me I'm a weak man.
Yeah, oh, you're definitely a weak man because you wish to hang up the phone because you don't understand the language I speak. I'm trying to explain to you, right? But are you going to listen? You've got 2 ears and 1 mouth. Why don't you use your ears?
There's no point, sir. There's no point.
I do not need you to hang the phone up on me. Only a weak man would do this. I don't think you're a weak man. I think you're a man who just needs to listen to what I'm trying to tell you, sir. I don't think you're weak. And he still hangs up. Oh my God.